ProSport Physical Therapy and Performance has partnered with 3 Planes to offer the latest in 3-dimensional movement testing for athletes on our turf. Using the information from the test, we as physical therapists are able to work with the referring physician to make sure the athlete is safe to return to the field.
So with 3 Planes movement, we're able to take high-tech equipment and put objective measures to a return to sport, return to play decision. We're able to take that information and help the athlete with what they're supposed to do next, with where their rehab needs to go from that point in time.
This is especially important when you're dealing with athletes that have had a severe injury or are coming off of surgery, such as an ACL reconstruction. Today we're testing Hunter Henry from the Chargers, who has gone through and completed his ACL rehabilitation protocol. But today is about making sure that he has the stability in that leg to return to the field and minimize any chance of future injury.
First thing that I always do is strength. So we have a handheld dynamometer that's able to tell us what percent normal the athlete has for their quads, hips, calf, anything that they need. The next thing I always do is a running analysis. So we get them on the treadmill, and the main thing we're looking for there is symmetry between the right and left. Then the meat of it is what we call the movement performance assessment. It consists of 6 different skills. The first one is a step down. Have them do 10 step downs, and we score the last one looking for things like knee valgus, pelvic drop, hip strategy, etc., depending on what the athlete has injured. Then we do a depth drop to jump. So that's looking at shock absorption on 2 legs. Then we do a triple hop. Triple hop is 2 components. First thing is making sure that the injured limb can hop at least 90% of the same distance as the non-injured limb. We also do a lateral shuffle with the loading onto that injured leg and going back. Another one we do is a deceleration in the sagittal plane, so that single leg sagittal plane loading. And then maybe one of the most important tests we do is a 90-degree run and cut. So this is looking at a transverse plane activity in a movement that is often how the athlete got injured in the first place. So this isn't just for the professional athlete. This is for any athlete, whether it's junior high, high school, college, beer league soccer, softball, any athlete that's had a lower extremity injury that is wondering if they're ready to play. This test is appropriate for all of those athletes. We also can do return to sport testing on upper extremity as well, or any sport that maybe doesn't look like football or soccer. We can change the tests to cater to the exact athletic requirements of the athlete that we're seeing on any given day.